I'm going to share with you the most common cause of carpal tunnel. Also, in my experience, I want to share with you the best treatment options that we have to help alleviate carpal tunnel discomfort. I'm Dr. Dave Adamson of Bonita Springs Chiropractic back and neck clinic. In my experience, the most common cause of carpal tunnel fall in one of two categories: major trauma. Typically, we see patients who fall in outstretched hands, or automobile accidents where they're hitting their hands on a dashboard. Minor trauma would be if you're doing fine motor skills repetitively, like keyboarding, putting something together, using your hands intricately over a long period of time. In my experience, the anatomy that usually gets involved with carpal tunnel is we have these bones in our wrist called carpals, and those carpals create this tunnel. And this tunnel is encapsulated with these ligaments, and you get inflammation within that, and it causes a lot of decreased space, which causes a lot of the pain that our patients experience. So frequently our patients come in and explain symptoms such as the pain. They might even have the inability to control certain muscle or fine motor movements, that have numbness or shooting pain into their hands as well. Let me take a quick moment and explain to you some of the best treatment options we've found in our office to help patients with carpal tunnel. Number one is chiropractic care. Any kind of manual therapy, especially chiropractic care, to help move the bones in the wrist to create more space in the carpal tunnel, allows that tunnel or that nerve not to be irritated quite as much. Also, we find that electrical stim, where we're using electricity to help decrease the pain and the inflammation within the carpal tunnel of the wrist as well, is extremely beneficial. And one of the other things that we use is ultrasound. Ultrasound is a modality that we use that uses sound waves to help create a healing effect within the tunnel to help decrease the inflammation and help decrease the pain. Now, in summary, we found that these therapies help our patients with the reduced pain. Also, it helps them relieve some of the muscle spasms or the numbness, the tingling, shooting pain that are down into their hands. So our patients typically report things like when they're at work, if they have to use their hands quite a bit, like doing computer work or keyboarding, or if they have other fine motor skills, that they're able to do that longer without pain. Also, sleep. People that deal with carpal tunnel typically have a lot of burning or painful sensations in their hands when they fall asleep. So by decreasing that, they're able to sleep throughout the night. And lastly, things like anything you're doing with your hands, like washing your hair, using a blow dryer, picking up a cup, because typically you lose that grasp. So by treating this, you help increase those fine motor skills and the strength of your hands again. So if you're dealing or suffering from carpal tunnel, give us a call at 239-221-7123. We look forward to helping you.